called Efficacy of Pulsed and Continuous Therapeutic Ultrasound in Myofascial Pain Syndrome. It was a randomized control study. The purpose of this study was to compare the application of continuous and pulse ultrasound with the use of a sham as a control group in individuals with myofascial pain syndrome, or MPS. The inclusion criteria for this study included participants that had an active trigger point in their upper trapezius, they had pain for at least 1 month, they were between the ages of 18 and 60 years old, and they had to sign consent to participate. Exclusion criteria for the study included anyone with fibromyalgia syndrome or other systemic diseases, a cervical herniated disc, injections of physiotherapy or trigger points within the last 3 months, neck or shoulder surgery within the last year, if they were pregnant, sensory limitations in the area of treatment, infections or lesions of the skin, and metallic implants or a pacemaker. Like I said earlier, this was a randomized controlled trial with level 1 evidence. There were 60 participants randomly assigned to 3 groups by a blinded researcher to the selection and consent process. Of the three groups, one group consisted of 20 participants, and they received a 3 megahertz and 1 watt per centimeter squared of continuous ultrasound. The second group also had 20 participants, and they received 3 megahertz of 1 watt per centimeter squared of pulse ultrasound. And the third group, also having 20 participants, received the sham ultrasound, which meant that the machine was turned off. Researchers also took into account history, age, educational status, and a physical examination was done prior to the study to rule out any other pathology. As an intervention, each participant participated in a 5-minute treatment session 5 days a week for 2 weeks. The same researcher performed each treatment, and they performed the ultrasound in a circular motion around the trigger point. Every participant was given additional stretches and range of motion exercises for their neck and shoulder, and they were also given a hot pack for 10 minutes. Each participant was also asked to record their exercise activity and medication intake in a diary. And the only difference between the 3 groups was that the constant and pulsed ultrasound received the 3 megahertz and 1 watt per centimeter squared of ultrasound, while the sham therapy had their ultrasound turned off.
Okay, so the dependent variables or the outcomes of interest were pain, severity of palpable muscle spasm, neck function, quality of life, depression, and patient satisfaction. So these were all tested with different assessments. You can see pain is the visual analog scale, the palpable muscle spasm was a 5-step scale, neck function, neck pain and disability scale, quality of life is the Nottingham Health Profile, depression was Beck Depression Inventory, and patient satisfaction was the 5-point scale. So the only outcome that was statistically significant was pain level at rest in the constant ultrasound group, and some different statistical analysis that they used to come to this conclusion was a chi-squared, a Will-Coxon, a Kresge-Wallace H test, a Friedman's test, Mann-Whitney U test, retrospective power analysis, and post-hoc power analysis. So the study included many strengths. Some include the random assignment to the 3 different groups. They had specific inclusion and exclusion criteria. They evaluated the patient's progress before treatment and after treatment at 6 and 12 weeks. It was a double-blind study, so the people that were evaluating the patients did not know the purpose of the study, so that helped decrease bias, and they helped eliminate some extraneous variables through a doctor examination to eliminate patients that had underlying pathologies that would interfere with the results. And also the assessments contain reliability and validity. So some weaknesses that were in the study were the convenient sampling at the Dickel University, the NPS criteria for this study. The participants only needed 3 symptoms of myofascial pain syndrome, when actually myofascial pain syndrome is diagnosed by 5 major criteria and at least 1 minor criteria. It had a small sample size of 60 participants. They also did exercises and had hot pack application with the ultrasound therapy, so we don't know if some of the results could have been skewed from the exercises in hot pack. And also, there were no objective measures. It was almost all subjective, so it would have been better to have some objective measures such as range of motion or strength. So we can apply the use of continuous ultrasound to occupational therapy in many ways. Some is that, this research study gave us a foundation how continuous ultrasound can improve pain, so this could possibly help reduce pain in patients with musculoskeletal injuries. It serves as evidence to use ultrasound as a preparatory task to increase performance in functional tasks, to continue to use for range of motion exercises and hot packs as a treatment. And further research is needed to decide which type of ultrasound is best depending on what the diagnosis is. And here's the reference for our article, and thank you for listening.